Hi everyone, welcome back to my YouTube channel, and today we are going to talk about scalp anatomy. So let's start our topic with introduction. Scalp is the soft tissue covering the calvaria, that is skull vault. It extends from supraorbital margin of frontal bone anteriorly to the superior nuchal lines of the occipital bone posteriorly, and laterally it extends to the zygomatic arches. It is thick, highly vascular, and richly innervated, thus making it important clinically in trauma and surgery. Layers of scalp. Scalp has five distinct layers, which can be remembered by the mnemonic SCALP. As the first layer of scalp is skin, second layer is from C, that is connective tissue, third layer is from A, that is aponeurosis, fourth layer of scalp is from L, that is loose areolar tissue, and fifth layer is from pericranium. Now let's talk about these layers one by one. So first layer of scalp is skin. This is thick and hairy with abundant spacious glands. This layer contains hair follicles, sweat glands, and sebaceous glands. This layer is richly supplied with blood vessels and nerves. Then there is the second layer of the scalp, as you can see in the diagram, that is from C, and it is connective tissue layer. It is a thick, dense, fibrous subcutaneous layer. This layer contains blood vessels and nerves. And this layer is strongly bound to the skin to the aponeurosis, and thus injuries here can cause profuse bleeding due to vessel anchoring. Next layer of scalp is aponeurosis, that is from A, and it is a tough tendinous sheet connecting frontalis muscle and occipitalis muscle. It connects anteriorly with the frontalis muscle and it connects posteriorly with the occipitalis muscle, and this provides attachment for the scalp muscles. Next layer of scalp is loose areolar tissue. It is a thin, loose connective tissue layer that allows free movement of upper three layers, that are skin, connective tissue layer, and aponeurosis. And this layer is also called as danger area of scalp because infection here can spread to intracranial structures through emissary veins. Next layer of scalp is pericranium, that is from P, and it is the periosteum that covers the skull bone. It is loosely attached to bone except at suture, where it is firmly attached to the suture area. Now let's talk about blood supply of scalp. Scalp is richly supplied by branches of external carotid artery and internal carotid artery. From external carotid artery, the branches include superficial temporal artery, posterior auricular artery, and occipital artery. And artery branches from the internal carotid artery that supply the scalp include supratrochlear artery and supraorbital artery. Venous drainage of scalp. Venous veins accompany arteries and drain into external jugular vein, internal jugular vein, and emissary vein that connect scalp veins to dural venous sinus. And these emissary veins are potential spread of infection to the brain. Nerve supply of scalp. Motor nerve supply is bifacial nerve, that is the seventh cranial nerve, and it supplies frontalis and occipitalis muscle. Then there is sensory nerve supply, that is by supratrochlear and supraorbital nerve, that are branches of ophthalmic division of trigeminal nerve. Sensory nerve supply is also by zygomaticotemporal nerve, that is the branch of a maxillary division of trigeminal nerve. And sensory nerve supply to scalp is also by auriculotemporal nerve, that is branch of mandibular division of trigeminal nerve. And it is also supplied by lesser occipital nerve and greater occipital nerve, and also by third occipital nerve. So this was all about sensory nervation of the scalp. Now let's talk about lymphatic drainage of the scalp. Anterior part of scalp drain into submandibular node, lateral part of scalp drain into periauricular and parotid nodes, and posterior part of scalp drains into occipital nodes. Functions of scalp include: first, it protects the skull and brain. Second, it hair acts as a cushion and helps regulate temperature. Third, rich vascular supply here aids wound healing. Clinical significance of scalp. First is profuse bleeding, as scalp wounds bleed heavily because vessels are held open by dense connective tissue. Second significance is danger area of the scalp, that is when infection in the loose areolar tissue, and this infection can spread through emissary vein to cavernous sinus and thus can cause intracranial infection. Third significance of scalp is scalp laceration. They are common in trauma, and aponeurosis tears, and it can cause gaping wound in the scalp that are really difficult to manage. Fourth significance of scalp is surgical considerations as flaps are raised in surgical procedure based on the vascular supply of scalp. Conclusion of this lecture video: scalp is a five-layer structure that protects the skull and is highly vascular and clinically significant due to its rich blood supply, venous connection, and potential for rapid spread of infections. And this was all about scalp anatomy. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.